you're relaxing, it's parasympathetic. When you are excited, it's sympathetic. Now, in well-trained athletes, take note in well-trained athletes. Well-trained athletes have bigger hearts. What's a big heart called in medical terms? Cardiomegaly. Okay? The term for a big heart is called cardiomegaly. Okay? Now, athletes have cardiomegaly, and we'll explain that when we talk about physiologic responses to exercise. So what happens there is because their hearts are bigger, it can accommodate a larger volume. So they don't need they don't need too many heartbeats to supply their whole system at rest. And that's why, for example, you guys know Lance Armstrong, the Tour de France cyclist, champion cyclist. His heart rate at rest is like 20 to 25 beats per minute. Yes, at rest. They recorded his heart rate to be 20 to 25 beats per minute. If that happened to us, we'd probably already be losing consciousness because the brain is probably not getting enough blood flow and oxygen. But for him, that's normal. Why? Because his heart is so big. But it doesn't mean he can love more people than he should love. It's just that he can now pump more oxygen and blood than he can pump. Okay? Okay. So sinus bradycardia. Now, another thing. The vagus nerve, if you stimulate the vagus nerve, it can also cause a release of acetylcholine, which will then slow down the heart. Okay? If you do things like a carotid massage, for example, you massage your carotids, you can actually slow your heart rate down. That's why be very careful when doing that, because you could actually lose consciousness if you stimulate your vagus nerve too much. Some guys are smiling. Oh, I have an excuse to absent from school. If I'm toxic in one subject, I will rub my carotid sinus and pass out in class. No. Okay? Okay. So, for example, carotid sinus syndrome will cause slowing of the heart. Now, physiologic causes like athletes. In sleep, in sleep, our heart rates can even go lower than 60 beats per minute sometimes. Okay? But it won't always stay lower than 60. Okay? It will still be within normal range. Hypothyroidism, hypothermia, electrolyte imbalance, an MI in the inferior wall of the heart. I mentioned this earlier, sinus syndrome. And medications like beta blockers, calcium channel blockers, and digoxin also cause slowing of the heart. So we'll talk about digoxin or digoxin later. Okay. So note how far the R waves are from each other. You see that? That's sinus bradycardia. Okay? So going now to atrial dysrhythmias. There are actually a couple of dysrhythmias. If I'm not mistaken, atrial flutter and fibrillation will be reported by one group. So I'm only going to be discussing 3. Okay? I'm going to discuss APCs, or atrial premature contractions, atrial tachycardia, and the most interesting one, paroxysmal supraventricular tachycardia. Let me ask you, at this particular point in time, in your medical life, does these 3 words look? Okay? Medical students always get rattled by very long and very complicated sounding words, right? But you'll be very, very pleased to know that when you say paroxysmal, it just means sudden. It's a fancy word for the word sudden. So it's a sudden onset. When you say supraventricular, what does that mean? Above the ventricles and a tachycardia. You see? So nothing to be afraid of with that word. Okay? But I know, I was a med student once. Okay? I used to be afraid of that word. Okay, so APC your premature atrial complex, what happens here is a premature ectopic supraventricular impulse will originate in the atria outside of the SA node. Remember, I told you about why did I erase the heart? Keeping my fingers crossed, my heart will look better this time. That was the Mickey Mouse. Okay, atria. Okay, the ventricles are still smaller. Okay. Now, remember I said the SA node here? Remember, going back to the story of the cowboys, right? That black guy, the black cowboy came in, who fired on the SA node and killed the SA node. That is another pacemaker over here. And because this pacemaker is faster than the SA node, it actually cancels out the SA node and it becomes the dominant pacemaker. And when that happens, the atria will not beat in its regular rhythm. It can actually beat before it's supposed to beat, okay, or contract. So take note that because, remember, why would there be an irregular RR interval? Because, remember, there's no more rhythm here, and the ventricles are dependent on the impulses from the atria. That's the reason why the RR intervals will also become irregular. Okay, the interval between R waves. And different shape of the ectopic premature, premature contraction. Okay, premature PAC. Okay, that's PAC. We'll see later what the shape is. Okay, so a premature P wave is followed by a QRS if the impulse is conducted to the ventricles. What does that mean? If the impulse travels in this direction, then the P wave will still come before the QRS. Makes sense, right? Okay? But if it travels in a different direction, then it's a different story. Okay? So narrowed QRS if conduction in the ventricles is undisturbed. Meaning, if there's nothing wrong with the conduction system in the ventricles, you will still see the normal narrow type of QRS. But the length of the PR interval will vary depending on the ability of the AV node to conduct the early impulse to the ventricles. Remember this, because this one will fire more than 120 beats per minute, usually. Alright? More than 100 to 120 beats per minute. What will happen to your PR interval? Will it go longer or will it go shorter? It will grow shorter. Okay? Every time the heart goes faster, please note, the PR interval decreases. And the heart goes slower, the PR interval increases. The problem is, it may distort the P wave. Okay? What we call a notched P wave. Best success if it reads 2-3 APF and V1, since you usually see the P waves most prominently in these leads. Okay? So, moving on. So at APC, what are the causes? Okay, number one is sometimes it's a normal finding. Believe it or not, there are times that some of us may actually have a premature atrial contraction that we don't know about. Why? Because sometimes it's just spontaneous. It happens like once or twice and then suddenly the heart goes back to normal. Stress, caffeine, and alcohol can cause that. When you say stress, not just physical stress, emotional stress as well. Have you ever heard of broken heart syndrome?
Yes.
Yes? Okay, some people are smiling because they think I made that up. No. Okay, it's a medical condition. It's what's that? Stress cardiomyopathy. Okay? Also known as broken heart syndrome. So, if you are going through a heartbreak right now, talk to someone.